Welcome to Thinking Green. I'm Rana, and we're pretty thick into this year's legislative session, and there is quite a lot going on. A lot of it related to money, revenue, how to get Connecticut out of its financial hole. And so I guess it's not surprising that one of the things that's being discussed is legalization of recreational cannabis. So joining me tonight is Jason Ortiz, who has been on the show countless times to talk about drug policy.
Yes,
and is here again tonight to talk to us sort of about the different things that are happening in Hartford and also what's happening on a broader scale in terms of cannabis legislation and industrial hemp legislation for that matter. So, yeah, welcome, Jason. And I don't know if you really need an intro, but maybe let us know what you've been up to the last few years at least. I mean, I think we've been talking together about this subject for like half your life at this point.
Exactly, it's true. Yeah. And we're making a little bit of progress. Not maybe as much as I would have liked, but yeah, so my name is Jason Ortiz. I'm currently the Vice President of the Minority Cannabis Business Association, and also more recently I became the Political Director for CURE-CT, which is Connecticut United for Reform and Equity. And so we're a Connecticut-based group that's looking to push legalization here in Connecticut for this session, and so we were able to get one of our own bills introduced, which was SB 690, an act to create a cannabis equity program for Connecticut. And so that's been the big thing that's been taking up a lot of my time, but I also do work on the federal level policy, and I just got back from a trip to Puerto Rico where the MCBA, the Minority Cannabis Business Association board, met, and it was quite a time. There was a big burgeoning industry there, despite the hurricane, definitely setting things back a little bit, but folks are definitely regrowing and rebuilding, and their governor just announced an executive order to basically encourage and legalize the production of industrial hemp throughout the island. And so there's actually quite a bit of positive progress in Puerto Rico on cannabis, and less so here in Connecticut, unfortunately.
We are the land of steady habits.
Right. And so we have a number of bills that have been put up. Like I said, SB 690 is the first one. There's another bill, HB 5595, that I am not in favor of, that is also up there, that would legalize the sale of marijuana for some people, is what I say about that one. But there's a number of different vehicles, and so we're hopeful moving forward that grassroots pressure can get something done this session. That being said, there is a tremendous amount of money from the current growers and other big businesses that want to come in and own the entire market to try to make it only legal for a select few. And so that is one thing that we're very conscious of something that's happening in other states as well, of big marijuana coming in and enforcing a monopoly system. And so while we are very hopeful that SB 690 can do some really amazing things, we are very cautious that if we are going to legalize marijuana, that we do it right.
Well, I know I have not been across the border to Massachusetts, but looking at the pictures at huge fancy stores, almost like mall looking, and it's interesting to me because we travel to the Pacific Northwest every year. My in-laws live there, and we were in Seattle, maybe about 5 years ago, and then we spend most of our time in Oregon, and I can't say that they put their laws in place with equity in mind. It's a pretty white part of the country.
Yes, it is.
And I think the people in power don't even notice that there are people living there who aren't white. But what I noticed is it's a much smaller scale and much more decentralized. Salem, Oregon, which has a population of about 140,000, maybe about the same size as Bridgeport, though a newer city. And if you look on Yelp, there are at least 30 small dispensaries.
Sure. Yeah.
So I'm guessing they're not all owned by huge, big money corporate interests, because they are, kind of the size of grinder shops
Right.
in Connecticut.
For sure, yeah. I mean, it is a different approach on the West Coast, and I think the big difference was that the West Coast had a very established medical system long before recreational came, and so there was already establishments working, and it was much more focused on patient care, specifically in Oregon, right? They had a very strong caregiver model where patients could elect to have somebody grow cannabis for them, and it created these very small craft niche, cultivation facilities, which I think is the way to go. And actually, Bo, in Portland, Oregon, they have one of the more progressive equity programs where they actually have given out $50,000 in grants to people
Wow.
of color in Portland, Oregon. And so, big props to MCBA's former president, Jesse Horton, who is an African-American cultivator in Oregon who helped to work through the city council there to make this a priority for them. So even in Portland, Oregon, as far on the west as Portland, it is an issue that's come up all over the place. And so we see in Massachusetts, they included it in their ballot initiative specifically to have equity. And so when we think of equity, what we're saying is the folks that were most impacted by the war on drugs are the communities that benefit the most from the legalization. And so that is as owners, who actually owns the businesses in those neighborhoods. That's as employees, because there's definitely a lot of jobs to go around that are very high-paying jobs. And also as communities benefiting through the revenue generated as community grants and other support to actually either fund schools or fix roads or whatever it may be. And so we want to make sure that when we legalize, those communities are at the forefront of the discussion. And so when we say equity, those are the things that we want. And this is something that is happening, around the country. It's a hot topic. There are a number of different states that have passed equity policies, Massachusetts and California being two of them. And very recently, Alexandria Cortez at the recent congressional banking hearing, made it a point to talk about the lack of opportunity for those communities to enter the current market. And so it's something that is being discussed at the highest levels, all the way down to the local level, like say Hartford, Connecticut, which recently passed a resolution to create an equity working group for the city of Hartford. And so we're seeing the need for both specific policies, but also people willing to take leadership roles on these issues, all the way from the city level to the federal level.
Well, that's good to hear. You've probably heard this before, but one of the things that got me interested in drug policy was as a preschool teacher. The last year I worked for Head Start, I had a class of 12 kids, and 4 of them had incarcerated parents. So these are 3- and 4-year-olds. A third of my class had incarcerated parents, and none of them were violent crimes. They were all related to the black market drug system. And so those kids, that was like 2006, it was just when Cliff was running for governor, and now those kids are in New London High School, 10 years later, 10, 12 years later. And so the schools are having to deal with kids who were orphaned by the criminal justice system when they were 3 years old. And it's not always cheap to do that.
No, I mean, the war on drugs created a tremendous amount of trauma in our communities and just about every community, honestly. And so figuring out how we can undo that damage should be the main topic of discussion when we talk about legalization. And so sometimes it is and sometimes it isn't. But for us, the war on drugs has affected us in medicinal ways, in health consequence ways, in financial ways. There's been economic oppression for decades in our communities. And, to take a huge percentage of the fathers and mothers of our families and put them in prison has devastated our communities. And so we need to have an actual assessment of the damage done. We need to have an equity analysis for the state of Connecticut to see what happened and which communities were most affected. And I think when we do that, that data should be the information in which we decide where the money goes. And so that could be by arrest records, it could be in a number of different factors. But one thing that CURE really wants to see happen is the creation of an Office of Justice Reinvestment. And so we believe that unless an entity is created specifically to address the community reinvestment, the understanding the current situation of these communities, it's just going to get lost among the shuffle of all the other folks trying to access that money. And so this is something that is a part of SB 690. It's something that MCBA came up with through our multiple policy summits. And so we think that's the discussion we should be having, right? It's like, how are we going to regulate and ensure the communities most impacted get this money?
And, so I guess I did write down what the Cure's
Sure.
elements are.
Yeah, nice
but
10 elements of
yes,
pickleball.
but
Uh-huh.
so I guess my question to you is, because you're involved with both organizations, is how does their work like dovetail one with the other?
So for the most part, MCBA is taking a very high-level approach, and CURE is the one that is going to implement and try to pass the laws that MCBA recommends. And so MCBA has the ability to pull national experts from all over the country to draft what is ideal policy. But we don't have the capacity to, say, be in all 50 state capitals all the
Right.
time. Even just here in Connecticut, where I have a lot of support, there's 11 lobbyists for the medical marijuana industry, and so there's no amount of organizing that I can do that can confront that directly, right? What we can do is apply pressure outside of the Capitol and outside in people's districts, and talking to constituents to get pressure to come from there. But it is definitely figuring out how from top to bottom we can tell folks how to legalize marijuana has been very helpful. Many folks are very interested in that policy. And so MCBA has drafted model state regulations, and we're about to release our model municipal ordinance so a city can ensure that they are doing their best that they can in order to ensure equity. And so these model policies are what groups like CURE then can run and push in their home states.
Oh, yeah, okay, so that kind of makes sense, because I was not quite sure how that all
Sure.
yes, how that all worked.
Right. Yeah. And MCBA is much more likely, and we will be pushing at the federal level, right? Because we have a lot more membership and also just power when it comes to DC regulations than a smaller group like CURE really can. We can pressure folks like Congresswoman Jahana Hayes or Joe Courtney, but to really be there in a forceful way all the time takes a national organization. And so MCBA is that vehicle, and then we try to help as many local groups push as best they can.
Now, is it a particular challenge that under the Malloy administration, when medical was legalized, that program seemed very designed to
Exclude.
advantage,
Yeah.
yes, people who already had money?
Correct. Yeah, absolutely.
So, so when you say, lobbyists from the current growers, these are big money concerns.
Yes, absolutely. So in the initial medical marijuana rollout, it was actually one of the first bills I had ever considered changing my position on to say that I am against, specifically because of the limited number of licenses that were going to go out.
And it was like a very high,
$25,000 non-refundable deposit and a
Yeah.
$2 million escrow account that
I
you had set
remember
aside.
you had to have
Right,
a lot of
right. So you had to
access
have
to
both
money.
a lot of money that you could just not touch, $2 million that you could set aside and not touch at all.
Whoa.
And for everyone, and there was 60 different or more applications. For all of those applications, if they told you no, you're not going to get the license, they kept your $25,000. And so you had to be able to part with that on a chance that you likely weren't going to get it, right? Because if there's only 4 and 60 people apply,
Oh my
the chance
God.
is pretty low. And so it ends up being all kinds of different corruption events that happen in that process. There's actually an interesting article that just came out by Greg Smith from the New London Day, right, that detailed some of the difficulties entrepreneurs face trying to enter the industry. So Connecticut designed the medical marijuana program to be exclusive. It did not have any people of color in it at the beginning, and now some legislators would like to see that same group be given priority access the second go around. So we're going to double down on the racism that we'd started with under Malloy. And so that is not what CURE is about and what we want to make sure doesn't happen. What we would like to see is more like what we see in Oregon or California, that if somebody wants a license, they are approved or disapproved on that license based on the merit of their application, not a competition with the other folks in the process. And so that would allow smaller businesses that can figure out what they're going to do, at least a shot in the door, a chance to do it. The other piece is to allow the municipal level to choose how many and what type of licenses they want to give out. So instead of the state of Connecticut saying we're going to have only 4 growers, New London can say we'll have 3, and Groton can say 0, and Stonington can say we want no growers but 2 retail. Whatever the town wants to do, we would prefer to see that approach.
Yeah, decentralize it
Yeah,
to the greatest
exactly.
extent possible, because we all know all our towns are really different.
Right, and that's okay, and I think we can embrace that. And maybe a town Like Willimantic wants to have cultivation facilities, but they don't want to have retail. They don't want to have people coming shopping there. But a city like Hartford that has actually passed 2 resolutions unanimously twice saying that they definitely do want it can have 10 if they want to, right? Or a place like Bridgeport, which has fantastic access to New York and also the shoreline, can maybe do cannabis tourism. And they don't want to have manufacturing, but they want folks to be able to consume it in hotels or something, right? And so that's definitely up to what we would hope, up to the different municipalities to choose how they want to do it.
Now, do any of these regulations deal with people's ability to grow small quantities at home?
So yes, they all do in some capacity. I think at this point it's roughly either 6 or 12 plants that is in there. But I will say, whenever I talk to elected officials, that's the first one they're willing to throw under the bus. They'll say like, well, we put it in there, but we're probably not going to get home grow. And so that's always something that is surprising to me as far as like who is opposed to home grow specifically, right? Who is pro legalization but anti home grow. But it is because if we allow folks to do that, the patients, right, the folks that are in need of this particular plant will no longer be beholden to particular growers for their medicine. And that will prevent lots of various types of medicine from being sold.
That's it. Because I think about like agriculture in general.
Right.
I mean, because ultimately we're talking about a plant.
Absolutely. Yeah.
And, you know, we can grow plants in our backyard.
For sure.
And it doesn't come under any government regulation if it's for our own use or we give it to our next door neighbor. If we try to sell it at a farmer's market or then or you know, create some kind of value-added product from it, it does get regulated and should. So it just seems odd to me that how we approach this plant is so much different from how we approach other plants.
Right. Well, and I think there is a concerted effort to not allow folks to consume cannabis in the world, right? We've seen both alcohol sales and pharmaceutical sales drop in states that have legalized medical marijuana. And so when we see actual data, that's when corporate boardrooms start to decide they're going to invest money to slow it down. And that's something that we can't avoid that conversation. Like, it's real. It is. It's having amazing benefits in both of those worlds, both when it comes to opiate addiction and also alcohol. And we know that those are 2 ginormous industries, specifically here in Connecticut when it comes to pharmaceuticals, but the alcohol industry in general. And one of the families that have bought into the cannabis industry is the Jim Beam family. And so there's actually, they are part of the GTI, the Green Thumb Industries Group, that recently bought AGL, Advanced Grow Labs, which is in West Haven, for $80 million. And so we had 4 growers. Everybody else in Connecticut was denied the ability for that opportunity. They then sold it to an alcohol selling family not that long ago. And so the Jim Beam family would, in theory, have access to licensing before I would, or before you would, or any of the small entrepreneurs in Connecticut would.
Well, and I think, you know, there are some helpful aspects to regulation. My brother-in-law works for the Oregon Department of Agriculture, and the first year they had legal recreational, about 60% of their crop got thrown away because of high pesticide.
Oh, yeah, exactly.
So, I mean, it's really, I mean, there are some things that regulation is really good for. You want to know you're not ingesting other poisons, whether it's like taking an ibuprofen or, you know, cannabis.
For sure. As I would with any product, including other medicines, right? I want to make sure that the thing that I'm taking and putting in my body is what I want it to be. And so, for example, I want to know when I'm drinking a can of beer that it's only 5% alcohol, not 80.
Right.
You know, and there's different times for different things. And so I think there's that. And there's also the labor standards that we have to think about too. There are tons of people currently paying their bills with cannabis money that maybe aren't working in the safest work environments, dealing with pesticides, dealing with you know, harvesting and physical things
and they
like
really
that.
have no recourse. Well, we have a phone call.
Oh, great.
Hi, you're on the air.
Hey, Rona, Dennis from New London here.
Hi.
I'm curious, what's the comparison on the prices of legalized marijuana compared to the black market marijuana?
Legal marijuana is more expensive at this point. But what we saw in Oregon, actually,
The price
was
went way
down.
down.
And so right now there's restricted supply based on the war on drugs, essentially. And so when you restrict the supply to a really high demand, the price is going to go up. But regulation also does cost money, and there's different pieces of that. So it'll start out being more expensive, but then within a couple of years, the price per pound drops dramatically. In Oregon, they actually had overproduction, and it was way, way, way cheaper. And some folks may say, oh, that's a bad thing, we have too much marijuana, but it's actually much more beneficial to both the consumer and patients. Because specifically, patients are folks that need a high quantity or a concentrated dose, and those can be very expensive. And so I do think while the growers will get hurt by a lower price, our medical patients will benefit from that. And over time, the price goes down pretty dramatically.
All right, guys. Thanks a lot.
Yeah, thanks for calling, Dennis.
Yeah.
Yeah, the price thing is kind of an interesting issue because someday, of course, we might have universal health care. And at
Yes,
least,
for sure.
like, if you have a prescription, one would think that insurance
Sure.
would cover it.
Right, right. And it has come up in conversation whether or not it should. And the interesting thing for states is that cannabis is significantly cheaper than many pharmaceutical medicines. And so as the price of cannabis drops, the amount of savings for a state could be dramatic. And so it's something that I think all of our policy and health advocates in some way know that there is that benefit that has not been analyzed yet as much as it could be. But it is going to be the way of the future. I mean, now we're finding ways to create cannabinoids not even with the cannabis plant. And so the medicinal properties of THC, of CBD, of some of these other terpenes and things like that, that will be isolated away from the plant, and now it's going to have to be a whole new conversation because what was originally seen as the problem will be separated from the plant, and we'll have to have whole new laws to govern that.
And, I kind of fear that as happens so frequently, becomes under the purview of Big Pharma.
Sure.
I mean, originally opium was, seeds of a plant.
Right. This is true.
And now opiates are highly refined and
correct.
And only created in extremely controlled conditions and, in theory at least, marketed in very controlled conditions.
Right, and that would be what we don't want to see happen, is that the cannabis plant is monopolized by industry, and this is definitely something that has been on our concern of policy advocates for a very long time, patenting of plant DNA and things like that. We have to make sure that it is decentralized as much as possible. With the recent Farm Bill, it was interesting to see how the CBD products spread quickly everywhere and with very little regulation as far as what was actually in any of these things. We could make a lot of claims.
Yeah.
So we can see how a policy change can rapidly improve or hurt things depending on how the policy is written, because that is a space where I think regulation clearly needs to be improved, because there are some wild claims being made about substances sold in gas stations. And so I think it's important for folks to do their research on what it is that they're consuming or they see in the stores and find out what really is hemp-derived CBD, cannabis-derived CBD, or various combinations of the two.
Well, to get away from the specific issue at hand, I think in this country we are sort of undergoing a kind of crisis in what the proper role of government is. And, we're seeing government shirking its responsibilities in some ways, in my opinion. I think some regulation is not protecting the consumers as well as it should be, and yet at the same time it's very intrusive into some parts of people's lives. So, this is just sort of like the microcosm of it. It's like,
For sure.
so how can regulation help people, the consumers, and the marketers all be safer, and the market be safer, and how, and what is, what kind of intervention is just helping rich people get richer?
Right. And I mean, I'm sorry to say that Connecticut's current system is more on the helping rich get richer side of things and not necessarily focused on the maximum good for the maximum number of people. I think one thing that sometimes left out when we talk about safety of products, there are huge communities of folks, like my community, my Puerto Rican community, that are a little nervous about cannabis medicine. And so being able to see that something was tested and it can be trusted and replicated means that more people will access that medicine. And so for me, making sure that the system is regulated is important, but it's regulated to the point of increasing access, right? We don't want to over-regulate it where we're restricting who can actually use this medicine, because it just means that my community is going to be left out both on the economic side and also on the health improvement side of things. And when it comes to who owns this industry, it's very clear what's happening right now, and so we need everyone in the state of Connecticut to call their reps and their congresspeople and say we want equity in the cannabis industry, because the way it's looking right now, we need to definitely change the current discussion around cannabis, or it's not going to go in a place that I think we should support.
Well, and I did actually look up the two bills.
Sure.
And SB 690, which was introduced by Gary Winfield,
Yes. Yeah.
who I think has been a good advocate
Yeah,
for a long
absolutely.
time.
Oh yeah, many issues.
And it's really a really simple, short bill. It's kind of funny. It sort of reminds me of something that New London Board of Ed passed a couple years ago, an equity and diversity policy,
Right.
so that anything that came after would have to be compared to make sure it was compatible.
Right.
So I don't know, how is it looking for 690? I see a
It's
whole
a-
long list of
Right.
co-sponsors for the House bill
Right.
and not a whole long list.
Right. So
On the
we have
Senate
we have
bill.
10 on the
Here,
Senate
yeah.
bill. So we do have 10 co-sponsors on our bill, but it's in the Judiciary Committee. We're still fighting to make sure we get a hearing on that bill. It hasn't been given one yet, so that's where that one is at, but it can still be brought up at any time. And so we actually haven't seen any hearings on straight up legalization at all. It's been hemp or changes to palliative care or different smaller changes, but we haven't seen any bill come up. 5595,
Yes.
which was
And it's
introduced
much
by
longer
the
and-
Progressive Caucus, was a bit of a hot mess of a bill that I was outraged by, I'll say, when I first read it. There's provisions that would allow police to blood test folks on the side of the road based on simple suspicion of consumption. It would add police to schools as drug enforcement officers, and it would also give only the current license holders the first access to the licenses. And so first access could be a year, could be 10 years, could be forever. Who really knows what that is? But there's nothing in here about communities most impacted, nothing here about patients, and it's just very much not what we would like to see happen. There is reference to expungement, which is important, but when it comes to ownership, when it comes to employment, when it comes to where the revenue is going to go, they outline where it's going to go. I just disagree with where they want to spend it. I don't think we should be spending any more money on law enforcement after legalization unless it's for someone who is not a police officer to do racism retraining. But I don't think we should be adding police to schools as a way to mitigate the harm that won't come from legalizing cannabis.
And actually, prohibition already, multiplied law enforcement incredibly. If you look at,
Sure.
look
Yeah.
at what the LEAP people
Sure.
are talking
Yeah.
about, and how overnight their drug, enforcement departments got increased tenfold,
For sure.
and the clear rate on violent crimes went down. It's like, this is a place we should put on the brakes and head the other
Right.
direction.
Correct. Well, and I think that's the big thing that I saw immediately after reading this bill was just that the philosophy was wrong, right? Like they were going about it as if cannabis is bad or is the problem, right? And so the plant isn't the problem, it's the draconian laws that are affecting people that are the problem. And so this still makes it look like after legalization we should be scared of cannabis, and we shouldn't. And so the idea that we would add police to schools after we legalized marijuana made this a non-starter for me, and I had to speak out and make sure, because 5595, I will say, doesn't legalize marijuana. I'll say that 100%. What this bill does is it gives exceptions to the law for a certain group of people to sell marijuana. After this bill is passed, it will still remain a felony for someone who is doing an unlicensed sale of cannabis will still be a felony. And so it says it authorizes and regulates the retail sale of marijuana, but only certain people will be allowed to do it. And so that is a huge difference where 690, you can read it, it's very clear what its purpose is. It talks much more about hiring ex-offenders into the industry, making sure there's diversity, and specifically things like protections in housing and public services for vulnerable communities. are elderly, are in public housing and should be able to take their medicine. Parents should not be losing their kids over cannabis. And there are folks that are just in precarious situations that if they need medicine, say a student, a college student right now can't have cannabis medicine on campus. But these are all communities that 5595 doesn't even mention or address, where 690 puts them at the forefront. And I think you couldn't find two more different approaches to cannabis legalization than between these two bills.
So are there any of the Progressive Caucus people whom you've convinced to take their names off of it?
Sure, right. Well, so we haven't gotten folks to take their names off of this one, but we have had many folks sign their name on to 690. And so Representatives Robin Porter, Representatives Josh Elliott, Matt Ritter, who's the House Majority Leader, has also signed on to 690. There's 10 of them. But on 5595, I had an interesting exchange with Representative Jason Rojas, who is the chair of Finance, Revenue, and Bonding,
And he is generally fairly progressive, right?
Yeah, well, I mean, yes, and he made it very clear. He told me 5595 is dead.
Oh.
And so he made that. I don't consider Facebook comments like official statements by the government, but that is what the leadership is saying about this. I'll wait and see the death certificate whenever that comes out to make sure this is done, because this is really bad. But I don't think there is one bill other than 690 which just addresses different things than most cannabis bills. There's not another straight up legalization bill that has been put forward with any detail as to what it will entail. And so that's a little worrying that at this point in March we don't have a full bill to really debate. So I'm hoping they stick with 690 and push this forward and flesh it out from there, and that equity becomes the backbone of the industry moving forward.
Now, what have we learned from the states that have already legalized? You do hear still scare, stories that crime is up and traffic accidents are up and students' grades are down, and it's really hard to know one, whether it's true, and if it's true, correlation is not
exactly
the same as causation, and it's hard to figure out exactly what's going on. So to the best of your knowledge, what have we learned from the places that have legalized?
Well, we've seen youth use go down. We've seen dependence
as they did in Europe.
Right, exactly. And that's the other thing too, is that there's data outside of the United States that folks sort of ignore exists, right? But there's Portugal and a lot of different countries in Europe have lowered their penalties for marijuana. But in Colorado specifically, there was a national health survey that's shown between 2008 and 2016, teen use went down 3%. Well, actually went down more than it's from 12 to 9, right? So it's a pretty significant reduction. And it did go up slightly when it first legalized, and now it's dropping pretty significantly. We've also seen no real data. I mean, you can find studies that say one thing or another that shows an increase in traffic. And traffic fatalities or traffic accidents due specifically to marijuana. What we are seeing is that the states that legalize marijuana see an increase in population, and so those increases are going to be reflected in all the data for that state. So in Colorado and Denver specifically, the population is booming, and so per the numbers, you might see an increase in total traffic accidents, but it is also because the population is growing significantly. And so all of those communities, none of them have turned around and said, we think this is a bad idea or we made a mistake. California, Oregon, Colorado. The only thing Colorado made a mistake with is they undershot how much money they were going to make. And so they had to have another referendum to decide what are we going to do with the extra money that we weren't appropriating before. And since Colorado has pretty strict appropriation guidelines, they actually had to go back to the voters, and the voters said, send it to education.
Wow. Connecticut should only have that far.
Right. It was literally,
can't even imagine
Colorado had to have a special referendum to deal with a surplus of cannabis dollars.
Wow.
Yeah, we're talking about, we're going to tax groceries, we're going to put in tolls, we're going to put in taxes on cigarettes and sugary drinks and just all these other things, but our current government didn't put any cannabis revenue in the budget. And so it's really frustrating to see a Democratic majority gain so many seats, but still not put some of the, what I would consider low-hanging fruit on the table so that we can finally get this moving forward and making money for our communities.
Well, and just in general, the budget seems
a little
really
regressive.
very regressive. you know, tolls, I don't mind
Right.
tolls in a way, but tolls, once again, you can do it right and you can do it wrong.
Sure.
And if you do it wrong,
Yeah.
it's very regressive. You could end up taxing, you know, working class people who
Right.
are have to get on
Right.
the highway to go
And
to
have
work.
to bear 95,
And-
you know?
yes, and not really collecting the revenue
Right.
from the people from out of state or the you know, big trucks or whatever that
Sure.
you know the surrounding
There's
states
a lot
are
of
all
trucks,
doing.
man. Yeah.
Yeah. Well, you know, one possible issue is like, why are the waste stations not open?
Right, right. Yeah,
like
I mean,
we-
and that's kind of the bigger problem. It's not, I mean, I support tolls and making sure infrastructure is strong as long as everyone's paying their fair share into
Right.
the grand pot, right? It's one thing to say these smaller pieces are right or wrong based on, you know, the sort of philosophy behind it, but if the wealthiest among us are not also contributing into fixing this problem, then I'm less likely to support regressive taxes.
Right.
And so as a bigger picture revenue, you know, it makes sense. But so do a lot of things that make sense that aren't in the current budget, right? And so closing the carried interest loophole,
Right.
legalizing marijuana, right? There's a number of things that taken as a package I would be supportive of. But we're seeing only the ones that are targeting lower income communities, and also the staffing of the folks making the decision has not exactly reflected those of lower income having a voice at the Capitol.
I remember when I first looked at 5595, one of the things that really jumped out at me was that the retail outlets would be in
Right.
poor cities.
Right, right,
But
right. Well,
nothing
enterprise
about
zones,
who
right.
was going
To own
them
them.
in the
Right,
enterprise
right.
zone. And as a person who's lived in a poor city, for the last 25 years, it gets really tiresome to see rich entities from
Sure.
around the city sort of getting rich at our expense.
Right, for
and
sure.
you know, it already, dependence on property tax puts us in that situation that we're subsidizing the surrounding communities.
right.
And here, okay, so people living in those communities that we're subsidizing
Right.
can come and make a bundle,
Right.
on Coleman Street.
Yeah. And I mean, it was one of the more outrageous portions because I think that maybe, I don't know the intent behind whoever wrote this particular bill, but maybe it was intended to be a way to do something nice for our communities and just very tone deaf about it. And that we are not interested in just having somebody else come in and run our communities ever, cannabis or not. And so the idea that the way you're going to mention those communities is we're going to bring somebody from outside who owns it to come and run it there and you get no benefit out of it was offensive to me, right? Like there's lots of ways that this could have been written very differently, but the idea that you would first make it in enterprise zones, which is its own problematic idea, but that the solution to our problems is folks from outside coming in and taking our land. Right, because that land is going to be bought by people from out of state, maybe even out of country. They have all kinds of different investment going on right now, and that you're going to say that as the way to help our communities and nothing about our schools. And so it was the tone and the intent and the philosophy behind it that makes me just simply think we need to have a lot more conversations with our progressive caucus about what progressive cannabis policy looks like, because this is definitely not it.
Now, going back to kids and schools, and right now there is still a school to prison pipeline. There are
sure.
still many schools, especially in urban districts, that have more police presence than social worker presence.
For sure, I would guess all of them, but yeah.
Prohibition kind of fed that.
Sure.
But what can we do to turn that around? This is really a big problem,
Sure.
and it doesn't protect our kids. I know some people, maybe some people watching even, who really are concerned that legalization would increase use by young teens who probably shouldn't be using it developmentally.
For sure,
It probably is not the very best thing for them.
Sure.
But what we're doing now does nothing to protect them.
Right,
and
right.
So I don't know. How can we change even the attitude in our schools away from like policing being the answer or zero tolerance being the answer?
I think we have to take a number of different approaches, and it kind of depends, who we're communicating with, where their fear comes from, right? And so there's administrators and there's parents, and then there's other young people, right? And so administrators are very worried that someone is going to get hurt on their school, on their time when they're there. And so they have certain concerns that can be met with school policies and changing the way that we approach punitive punishments right now, where we're going to punish a student and make an example out of them, rather providing restorative practices or support services, which I think can be funded through the cannabis revenue. And so something as simple as adding a significant number of teaching assistants to a school can dramatically reduce the amount of physical altercations that students have, the number of suspensions, expulsions, after school programs needed. And so we do think that taking cannabis money and directly hiring teaching assistants would be a fantastic use of it. That, in my opinion, helps to essentially reduce class sizes, right? Because you have more folks in the classroom. And so that is one thing that administrators are worried about change, right? Whenever things are changing, they're not sure how the policy is going to look afterwards. But any administrators that are out there, come and talk with us. I was one of those students that got arrested when I was in high school at the age of 16 at Norwich Free Academy. And I got suspended for 45 school days. And so
Wow, that's a long time.
It's a long time. It was like 3 or 4 months, basically. It was the beginning of November to the end of February. And I was charged with attempt to distribute to a minor because my friend was 15, was with me. And I got caught with cannabis on possession on a school ground, so they threw the whole book at me as a big bad guy. And so that experience is what drives students to become depressed, what drives students to drop out from school, to be disengaged with their family. And the number one predictor of addiction issues is feelings of isolation. And so for the administrators and the parents that are worried about addiction and their students getting access, expulsions and suspensions is going to guarantee your students are going to have these problems, where meeting them with compassion and reasonable understanding of somebody who's 16 and what decisions they make will allow them the ability to understand how to make proper decisions regarding substances in general in their life, whether they're legal or not. Because we have plenty of legal substances that we also have to have those conversations about.
Absolutely.
Specifically with youth, right? And so when it comes to those groups, right, administrators and parents, the data, hopefully, and the science can hopefully help them understand that if you really care about those, it's about the results that we should be concerned about, not whether something is moral or immoral. What policies and practices will actually get us to less addiction and less suffering, right? Other students, right, that maybe are unsure of what this is all about, we want to make sure that there's quality education and information for those students, right? And so having somebody that can honestly talk to them and tell them the difference between substances, what problematic use looks like, what happens if somebody takes something that they weren't expecting to take, right? If your friend eats a gummy bear on accident, what do you do? Those kind of conversations can help our students understand navigating a world where lots of things can have effects on your brain. And so I think by engaging those communities in various ways, we can address all those different concerns. But one thing we know for all of them is that locking up young people is not solving the problem. Putting more people in prison is not solving the problem. Students have been smoking marijuana in school since we knew about marijuana, and they will continue moving forward. The question is, how do we handle the harms associated with it? And I think the best approach is always going to be through science, reason, and compassion.
And when you mentioned science, I think it's pretty much been debunked that cannabis is inherently a gateway drug.
Correct. It's actually an exit drug for a lot of folks, and so it's really interesting if you do end up taking too much cannabis or, say, edibles, and you get sent to the hospital, the drug that they'll give you to help you calm down is CBD, another chemical from the cannabis plant, because what THC and CBD specifically do is they help our endocannabinoid system regulate our homeostasis. There's a lot of science words there, right? But we have receptors in our body and our cells that when cannabinoids enter our bloodstream, help us feel at balance, right? And so if you have a different chemical makeup than I do, strains will affect us differently. Right, and that's why some people like some kinds and some people like a different kind. Some people really like coffee, some people really like wine after work, right? And so figuring out what works for different people, you can make sure that everyone is helping their bodies feel as balanced as possible.
Well, and I think one of the things you didn't exactly say but really touched on is that, prohibition has really, not just for cannabis, but for all drugs, has kind of prevented honest information to get out there.
For sure.
And that creates like a lack of generational trust.
Sure, yeah.
That
I mean, you could thank DARE for just obliterating generational trust, because, I mean, we were told all kinds of things about cannabis that were just clearly not true.
Although I did meet one person who's probably not that different in age from you, who said, I learned to roll a joint in DARE.
Yeah.
It's like, this makes no sense.
I heard about all kinds of things I had never heard of in DARE and what they did, and it was just so clearly baseless. And actually, it was, even when I went to the University of Connecticut, we had a campaign specifically around the department, or I don't know if it was the Department of Health, but whatever agency it was, their educational materials. They were just wild, and the things that they would say was like they bought it from the 1970s, and we actually failed to change it, right? Like, it was one of those things that this is just update your textbooks kind of argument, and we just couldn't, they just didn't have any interest in changing it, and so it just didn't happen. But we have college folks that are getting training on how to deal with alcohol and various substances, and people can have really negative interactions with drugs if they're not educated, but our schools just refuse to modernize, and it will, in the grand scheme of things, cost far more lives than cannabis as a drug ever has.
Well, let's talk a little bit about industrial hemp.
Sure.
Because,
There's lots
if
going on.
we look back at history, it's possible that, that recreational might have been made, demonized because of industrial hemp.
Sure, yeah.
So what's the status nowadays with industrial hemp, and where do you see the potential going?
Sure, yeah. I mean, there's a lot of opportunity in industrial hemp, and so with the recent farm bill that was signed, that was actually pushed by Mitch McConnell, because he is Nebraska, I believe, or Kansas, I forget which one, but he has.
Say even the broken clock is
right.
twice a day,
Well, and he's got a lot of farmland in his district, in his state. And so there's been a lot of progress on that. That is one of the reasons the CBD products have proliferated so much. But I think folks forget how much we still use hemp all the time. I mean, hemp seeds are very high protein kind of food. But also on our ships, the big heavy ropes that we use for these big ships are often hemp. And definitely the ships at the seaport, the Mystic Seaport, have hemp all over them, and so it's,
they're caulked with oakum, which was hemp,
right,
which has to be imported often.
Right, yep. And so there's amazing uses for it. People are building houses, people are building cars, and you can make just about anything you need to, one way or form, out of hemp. And you can actually use it to extract toxins from the ground. And so hemp has a number of different uses. And luckily, some places are moving on it faster than others, but even Puerto Rico. So the governor of Puerto Rico has decided he wants people to grow hemp all over the island, and issued an executive order saying by June we want to have the licenses ready to go, so current farmers that are farming anything can farm hemp. And so it's a strange day when the island of Puerto Rico and all that it's going through has much more progressive cannabis policy than Connecticut.
So what's the status of industrial hemp in Connecticut now?
So there is a bill, and I forget the exact number, but there is a bill up. It just had a hearing, and so it is possible they could do it. In theory, everywhere can already grow hemp. It's just the states have to finalize the process. So if you're a farmer, the state can't let you do it, but the federal government isn't going to punish you for it. So there's this weird inverse of what's happening with cannabis. And so there are folks that are going to put seeds in the ground, and I don't think anyone is going to come bust them for their hemp. But the state of Connecticut needs to hurry up and actually put regs in place if the farmers are going to be able to account for all of that and pay their taxes and things like that. So, I don't have a whole lot of faith that Connecticut will move quickly to put out use regulations, because then we have to talk about equity in the hemp industry too, right? Like, why do certain people own farms and other ones don't right now? There's a long history in this country with giving some groups land and other ones not.
Right, and often in history, the ones who owned the land were not the ones who knew how to work the
Right,
land.
correct. And in the North is no different. And so that itself, right, if we just say those who have a farm can grow hemp without any addressing the historical context that all this is happening in, we're just cementing the racist outcomes. And so we cannot do that. And so that's why we've been telling the state, slow down and do this the right way, or it's going to cause a lot of problems for our communities. And so, unfortunately, the state of Connecticut, is just not actually actualizing our recommendations in a way that we can discuss. It's always very short bills. But as long as everybody contacts their rep and say, we want to know what's going on with industrial hemp, when is it coming out? I want to grow right now. The faster we'll get it.
Now, you mentioned a little bit about taxes, so I wanted to talk about banking.
Sure, yeah.
One of the claims I hear frequently about Colorado is the crime is up. And I don't know, I haven't analyzed, but it seems to me part of the reason crime is up is that there's a whole lot of cash around. So what kind of banking reforms do we need to allow people who are growing and selling legally to participate in our banking system?
Yeah, I mean, we just need access to loans, but the problem there is that even in a regular non-cannabis related space, access to banking can be a bit difficult for folks that don't already have a lot of money. And so we are seeing not only the traditional layer that is going on of preventing folks from getting capital, but then there's this whole federal layer also. And so actually recently, Congresswoman Alexandria Ocasio-Cortez had some amazing statements at the congressional banking hearing, specifically around the folks that were making money off of private prisons are now investing in the cannabis industry. And not only are they investing, but they are investing and pushing for themselves to have a monopoly on that industry. We saw in Maryland, there were people of color that were actually bumped off of the list for getting a license so that former police officers could be added to the list for a license. So there's this whole world that is making this not equitable as banks are actually starting to have the conversations. And so we are seeing congressional hearings happening about this. We are seeing different places begin to start to process just very high cost. The real interesting thing is that folks don't want to be associated with money laundering is the big concern. However, the state of Connecticut, the state of California, and the state of Oregon, and all those municipalities have been money laundering cannabis money through taxes for many years. And there are many donations that have gone to politicians from cannabis money. And here in the state of Connecticut, actually, there's so many going on that the State Election Enforcement Commission had to issue a ruling on whether or not cannabis license holders are state contractors, because they were trying to circumvent the state contractor contribution rules, and it became a hot mess. And so there's a lot of money at play. And so while banking, we need access to banking just to be protecting and not having giant duffel bags of cash being used to pay taxes in small towns, which is happening. But we also have to talk about banking and access to capital generally. And what does this mean for somebody that had their life destroyed by government action and now wants to make it right? What does that look like for that person? Is it a grant? Is it loans? Are there ways that we can have banks provide the capital and insurance? Yeah.
Okay, you have about, 30 seconds, well, maybe not even 30 seconds. What can people do in 15 seconds?
Call the representatives and ask them to support SB 690.
Okay, thank you, Jason. I guess we're out of time. And until next time, it was fun.
Thank you. You covered a lot.
Yeah.